Hi there, this is a video on how to remember the differential diagnosis and the pertinent questions to ask for abdominal pain. So let's begin. Abdominal pain. So in order to remember this, I have a diagram. The quadrants of the abdomen. I'm sorry. Okay, the quadrants of the abdomen. Let's first remember upper abdominal pain. And for upper abdominal pain, this is going to be the diagram. If you're wondering what this is, guys, this is the heart. And this is the esophagus, and this is the stomach. And we have the pancreas over here. Let's keep it as green. And then we have spleen. And then here we have the liver and the teeny tiny gallbladder. Okay, so these are the differential diagnoses that we have to remember for upper abdominal pain. Remember MI and then GERD, gastritis, inflammation, and in infection you can remember peptic ulcer disease because H. pylori can cause peptic ulcer. And then we have ruptured peptic ulcer, and we also have gastric cancer, which is, then we have ruptured spleen, and then we have acute pancreatitis, and then we have pancreatic cancer. Here we have acute hepatitis, which is most commonly caused by hepatitis A in developing countries. And then we have acute cholecystitis, and then we have ascending cholangitis. Now this, if you're suspecting acute cholecystitis, then remember female, fat, 40, and fetus, which means history of previous pregnancies is very important. Next, when we are thinking about acute pancreatitis, then we all have to think about an alcoholic male. That's the thing we have to think about. Now, let us talk about the questions that we are going to ask for a patient who comes with upper abdominal pain. First thing, food. This is what I'm going to write here. FITS. Fever. And here you're going to ask nausea and vomiting. All right. So first question we have to ask here is food. Any relationship with food? What type of food? And have you eaten outside lately? When you think about E, then have you been exposed to anyone with similar symptoms? Or have you been diagnosed with any infections or health conditions? Okay, exposed and diagnosed. Next, have you traveled recently or have felt any metallic taste or taste changes in your tongue, burning in your chest. So when you ask about burning in your chest, please also ask about SOB, sweating, and radiation of pain to any other part of the body. So we are trying to rule out MI over here. Next, we ask about stool. Any changes in your bowel movement? Any blood in stool? If the patient answers yes for blood, then you ask amount and when. When you ask about stool, please also remember to ask if the patient has any urinary complaints. On this side, you ask about fever and then any changes in skin color and distension of your belly. Distension of your belly. We here ask about nausea and vomiting. Here also we ask about blood. This is to rule out or any change in color, like coffee ground emesis. So apart from this, we are also going to ask important history, which is sleep, appetite, weight changes, diet, exercise, and fatigue. These are very important. Also, travel history is very important, which we have asked here. We are also asking about urinary complaints. And the next thing we have to ask about is medications, because the patient can be taking NSAIDs that can cause gastritis. And also past medical history is very important when you're thinking about, maybe the patient can tell you rheumatoid arthritis for which he's taking NSAIDs, or he can have history of previous symptoms, or maybe he can say pancreatitis, or he can even say history of gallstones. All right, that's it, guys. So these are the things that we have to remember for upper abdominal pain. The next thing we are going to talk about is lower abdominal pain, and I've made a separate video for that.